Welcome to another episode of Seeking Voices, exploring the science of health and healing. This is Dr. Monica Aggarwal. I'm a preventive cardiologist trying to bring science to answer questions that we all have about how to live long, how to live successfully. I had the pleasure of working with and listening to and interviewing Dr. Michael Vallis today. Dr. Vallis is a health psychologist based in Halifax, Canada. He's the associate professor in family medicine at Dalhousie University. He has a PhD and master's from the University of Western Ontario, London, and a bachelor's of science from Dalhousie University. His main expertise is in adult health psychology. He has an emphasis on obesity, diabetes, cardiovascular risk, and gastroenterology. And he spends most of his time working with healthcare providers to understand behavior change for chronic disease management. This is what I'm most interested in hearing about. He regularly supervises clinical and academic students. He's active in research on motivation, behavioral change, and adaptation to chronic disease. He consults nationally as well and internationally and is heavily involved in academic publications, journal editing, and clinical practice guidelines. He was an executive on the Canadian Clinical Practice Guidelines for the Management of Obesity in 2020. He was the lead author of psychological and behavioral chapters for the new guidelines, as well as the 2006 guidelines previously. He's the author of Psychology and Mental Health chapters. He received the 2024 Distinguished Service Award from the Canadian Association of Bariatric Physicians and Surgeons. He received the 2021 Charles H. Best Award from Diabetes Canada, and he holds a Queen's Diamond Jubilee Medal by the Government of Canada on the recommendations for Diabetes Canada. I'm really looking forward to speaking with Dr. Vallis today. I have so many questions about motivation, obesity, food addiction, so I really look forward to speaking to him about these things. I had the pleasure of meeting him when I listened to a talk that he gave, and I was blown away. I hope you enjoy this session as much as I will. I'm so excited to see you today, Dr. Vallis. Looking forward to our conversation.
Me as well, Monica. I think it'll be an interesting conversation for us.
Yes. So, Michael, tell our audience to start. How did you end up in this field? Because I'm always curious how a person you have very unique qualifications,
Well,
and as a psychologist, but focused on obesity and behavior change. I think that's really interesting.
yeah.
Tell us about that.
So thanks for asking. My story is to me interesting. So early in my career, I found myself in a very challenging situation, and here, in essence, is the challenge. As a clinical psychologist, PhD, licensed, where the model of practice was really around the psychopathology model. So I would be charged with doing an assessment and, making a diagnosis of what the mental health disorder of the person was. And my experience, though, very early was sitting across from a person and having the following experience over and over and over again. And that was, I think if I was in your situation, I'd be feeling exactly the same way. In other words, when I heard the quote unquote presentations that I was charged to turn into psychopathology, pathology of the psyche, it started to realize to me that no, I wonder whether these behaviors, these emotions actually are fit to the circumstance. And so
So they're very normal. You're saying they're very
exactly.
normal.
So then I shifted my practice from working with abnormal people in normal worlds, the psychopathology model, to normal people in abnormal worlds. The human brain is no longer adapted to the environment in which it lives. And that's primarily demonstrated through our behavioral action tendencies and through eating, because the eating behavior, in my opinion, is its own behavior. It needs to be looked at separate from other behaviors, because eating, essential for life, is hardwired into the brain. And therefore, there are a lot of hardwired brain structures that actually make it so difficult for people to navigate the world. So that sort of shift from abnormal person, vulnerable, requires a comprehensive diagnosis, comprehensive care. All of that is very legitimate. I completely applaud my clinical psychology colleagues who continue to provide services to people who deserve that kind of care. But I work in a world where we're asking people to change their behavior. When we know that behavior change is really hard, We know that habits form really quickly. We know that people get connected to their behavior. It becomes their norm. And then we see the changes are. So my focus is really on helping normal people make challenging changes given the current environment in which we live, which seems to be taking us down the road of chronic disease, weight gain, et cetera, et cetera.
That's really neat. That's great. So that's really what I'm super excited to talk to you about. I mean, I think, this we live in a world where, 70% of us are going to have a chronic illness. The prescriptions are getting higher and higher. Obesity, over 70% of us are overweight or obese. Everybody's struggling with food. Greater than 50% of certainly the American diet and certainly the Western countries are eating ultra processed foods. And so we struggle with what to eat, how to eat it, and we eat too darn much of it. And to your point, change in behavior, like how do we change that? So it might even be worth to start with our childhood. When do behaviors become cemented in our, I don't know if you know that answer, like how do we start out and and how long does it take to change a habit?
Yeah, those are really great questions. When does it begin? As early as 2 or 3 or 4 years of age, you start to see attitudes. So, for instance, the stigma against obesity, people living in larger bodies, it's documented and demonstrated that starts in kindergarten, that starts at daycare. Amongst children, studies have been done where children of ages 7 and 8 have been asked to select who would you like to play with. And so pick your friend that you want to play with and put them in order. And blind children, children with amputations, children with deformities, burn victims are preferred over people in larger bodies. And so even
Wow.
early in the time, you see that happening. And so it's actually really important for us as parents to think about the role models. And especially a real point, I think, is using food to soothe or using food to reinforce. And just, because those are parental behaviors. As a parent, your child they've fallen, they've had a disappointment. And then if you use food as a reinforcement, you're establishing a very strong emotional connection to food. If it's a reinforcement, if it's a soother, and they're so easy. You see, that's what is so important to appreciate, that the neural system around eating behavior, which has two components to it. It's got what we call wanting and liking. And there are neural pathways in the brain that are wanting pathways. And these are the neural pathways in which we hunt for food. And then the liking pathways where once we get the food, the wanting goes away and the liking takes over. And the challenge, of course, is that in our environment, we're exposed to foods that overstimulate the pleasure centers of the brain. They hijack these pleasure centers of the brain. And so those early exposures become, I think, really important for us as parents to reflect on. It's very difficult. You think about, how you would entertain children, how you would celebrate events, et cetera, et cetera. And so that establishes some of those initial patterns. And we believe that there are two things that would happen. One is a physiological adaptation. And so I sometimes say to people, I don't care what your attitudes towards Twinkies is, but if you had 2 Twinkies a day for 30 days, you'd develop a craving for Twinkies. Why? Because you have a human brain, and that's the normal reward centers of the brain being hijacked by substances. And then in our ultra processed food world, this becomes a huge problem. Once these behaviors get established, then it becomes really difficult, because then you ask the question, how long does it take to change behavior? Well, you can establish a new behavior in, a few weeks. But in order to a behavior to be sustained over time, we're really talking 2 to 5 years,
Hmm.
right? I mean, let's say we change our eating pattern. Well, let's be honest. If you were to change your eating pattern, it depends on the time of the year. What are you going to do on your birthday? What happens when it's time for Christmas vacation? When it's time for your summer vacations, etc. The calendar year is a minefield of food events, and it takes people time and practice. So it's actually really interesting for us to reflect on the sort of behavior is hard to change because habits form quickly, and we have to set up environments that support people over the long term. And then when it comes to eating, we all have that sort of the value of food, which is way beyond nutrition and much more related to connectedness and pleasure.
So many things that you said that were interesting to me there. So like let's think about those kids again. So it sounds like you're saying, and I really thought that was interesting. Most of us as parents, and I have three children, when we raise our kids, a lot of us as parents and as mothers, we might say to our kids, "Oh, you're having a bad day. Why don't we go get a treat?"
Yep.
Right. And it's that connection that you're saying that maybe isn't optimal,
Yeah.
or when people hurt themselves, or you know what, using it as sort of a soother,
Yes.
is probably a poor thing to create a habit around.
Right, exactly. And it's easy, it's a simple behavior, and it has such power to it than even anticipating that. So the child, after the 10th time this has happened, the parent says, let's get a treat. And the kid's brains have already started to fire up. They're already starting to feel better because of that sort of physiological hijacking of the pleasure centers of the brain. And so to the
Yeah.
parents, it's kind of like the rest of our parenting behaviors. Parenting is hard work, but it's incredibly
Yeah.
worthwhile. So rather than have a treat, you're having a bad day. Let's go to nature. Let's go into the
Yeah.
backyard. Let's see if we can find a couple of worms moving around in the soil. Let's go and look at the lake. Let's look at the desert. Let's connect it. Nature provides soothing environments.
Yeah.
If your child is likes physical contact, rub their back, hold their hand, put them in your lap, carry them on your hip. There's lots of these alternative pleasuring experiences. It's just kind of like it's sort of like food goes from 0 to 100 in an instant. And I think as parents, when we talk about sort of raising our children in an environment in which they can battle the food world, which is like enormously difficult to do, we could start our kids off well by that little bit of extra work that would provide the same result. And I would
Yeah.
wonder if we
Yeah.
reflect on it, whether in fact it might actually have a maybe not as flashy, but it may last longer, right? In other words, it may not be as, oh, that
Yeah.
tastes so
Totally.
amazing, but 2 minutes later it's gone, as opposed to walking in the park, playing with your kitten, your dog. Kind of, there's a lingering effect of the pleasure that's associated with those experiences. So I think we could
Yeah.
sort of make some strategies changes that could be of benefit with regard to this.
Yeah, I love that. So, because I do see so many patients now, and if I reflect child rearing and then I reflect my patients, most of my patients will tell me that they comfort eat.
Absolutely.
Um, and so I think that that's interesting to kind of reflect how that comfort eating starts almost when we were young,
Right.
and probably how we were raised. And so that's very interesting. And the other thing you said that I kind of want to think about a little bit with you is you said it takes 2 to 5 years you can make a quick change in 2 to 3 weeks or 2 to 5 weeks, but it really takes almost 2 to 5 years to really make a lasting
Right.
impact. Now, how do we, let's think about that, and maybe you could help us through that. I mean, that's very difficult.
Yes, it is. It is very difficult, but it's very worthwhile. And here's where it becomes, I think, super interesting to think a bit about is that so in other words, there's two stages to change. Many people think I just need to make this change, and once I've made this change, then I'm good. And you can make a change in a relatively short period of time. Right. So many people would do this. People, let's say you're a relatively healthy age, generally pretty well, and you think, I'd like to do a 5K run. I'd like to do a 10K walk and some sort of fundraiser event for cancer or some other worthwhile cause. And you then say, okay, I'm going to go into a training program. Maybe I'll join a club. And 3 months later, I've now ran this 5K run. I'm really happy. I've been doing a lot of exercise to do this. I feel much more fit. And then 6 months later, I'm not doing anything again. Like, how does that happen? And so the message here is making a change and maintaining a change are completely different behavioral change challenges. And so once we make the change, then we have to shift to how do I maintain it? And most of us, when we make change, we're using what I call escape motivation. I'm not happy with
Hmm.
myself and I want to be better. So I'm sick and tired of having no energy. I'm sick and tired of feeling really guilty for all of the stuff that I eat. And so I don't like this. I want to be healthier. Okay, then I work hard and now I am healthy. Good for me. But my motivation has been to get away from a bad thing. Now our motivation for maintaining the behavior is completely different. How do I have approach motivation? I need to
Yeah.
hang on to this because it's not easy because someone's going to come up to you and say, oh, I've got an extra ice cream bar here. Do you want it? Oh, there's more cake. Why don't we have a little bit more? Oh, I'm tired. Let's just call in Uber Eats or DoorDash or some commercial eating app. Uh, so easy to do. And it's a lot more difficult. You're
Yeah.
no longer in the state of saying, I'm feeling in pain and I want to get away. You're now saying, oh, that's really tasty, but no, I don't want to choose that because I need to keep the gains I've made. So it's a lot more of a challenge. And it's really
Yeah.
where we encourage people the negative, the pain associated that motivates the change will go away. So now you need a North Star. Now you need a
Yeah.
guiding light. You need to have what we call values based goals. How will this behavior make you a better person? How will this behavior actually take you closer to the person you would really like to be? And so it's a shift from getting away from a negative situation to sort of recognizing that this is hard work. Because remember, raising children, hard work. Having a long term committed life partner, hard work. Having a successful career over decades, hard work. But I got to be honest with you, raising children, having a life partner, and accomplishing something significant in your life work are what make life goes around. Like those are the core
Yeah.
essence
They
of
give you
human
fulfillment,
behavior.
right?
So in other words, when we start talking about values-based goals, it's not a matter of is it fun, is it happy, is it exciting? It's a matter of is it worthwhile, is it valuable, and is it consistent with how I see myself as a person? And so if we can help people shift away, I'm tired of eating this way, I'm tired of how it makes me feel, I want to make a change, great. Now that I've made the change, how will maintaining this change, which is going to be hard because it's going to be like a candle in a windstorm, you're going to be exposed to all of this environment that the human brain isn't really good at fighting against, right? The strongest predictor of what you eat is what's available. The strongest predictor of how much you eat is what's available. And what's available? Processed foods in large quantities without any energy to accomplish. You drive through, you call in, and it's there. And so this is a really negative environment. So those values based goals are kind of the second step. And those never go away, right? When does an honest person
Yeah.
decide to be dishonest? And the answer is never, because that's who they are and that's consistent with their values.
So, so much amazing stuff you just said. So, I kind of want to think about it with you again and kind of digest it a little bit. So, you know, when a person changes, to your point, and you can think about New Year's resolutions, which we talked about prior to our getting on the show here. And New Year's resolutions are quick. I'm going to change. I'm going to lose 20 pounds. It's associated with a quick change, and almost like because you don't like something about yourself, a negative thing about yourself. So those things are
Yeah.
quick, and you can change for a couple weeks, but often people regress back. And what it sounds like what you're saying is that's not surprising, because it's based around this sort of negative
Yeah,
feeling about ourselves.
absolutely.
Whereas
Yeah. And
when
so
we shift, yeah,
100%. And what's really interesting about what you've just said, Monica, is the fact that we've got a couple in North America. There's a couple of sort of implicit attitudes that we've developed. And those attitudes are kind of reflected in things like, go big or go home, right? Like we want to have big changes. We want to make changes really quickly, and we show those in our social medias. We always show the fastest people, the people who can lift the most amount of weight, and the people who have made this most dramatic changes. That doesn't represent normal people. That doesn't
mm,
represent the average person. And what we know about change is slow and steady wins the race. That rather than this sort of, I got to get it off, I got to get it all off, now I'm going to change everything about my behavior, the chances of success are very, very low. People who do those sort of dramatic makeover approach, and notice how that's such a popular social concept, because I
yeah,
think everybody just wants to make it go away. It's almost kind of like this instinct we have that if you're suffering, you just want it to go away. You want an instant solution. That's just human nature. And if we can accept, though, that complex problems require complex solutions, the actual success is more associated with small and steady movements. And so I often encourage people to think about what I call next step goals. And a next step should be just a little bit more than what you're doing, not so much that it's too hard to do, and you can't do it, continuously over time, because behavior that you engage in for short periods of time don't really improve your health. So you're kind of in it for the long run. So for instance, if you're going to say, I'm going to change my evening eating because that's when I tend to eat a lot of calories at night. If you say, okay, I'm going to stop evening eating from now on forever, I'm sorry, but you've got a steep
not going to
hill to
work.
climb. And I would say probably 95% of us will fail. And we'll fail because we're humans. That's why we'll fail, not because
So
there's
what
anything
would
wrong
be
with
a
it.
more yeah? So then, what would be a more gradual
The more
change?
gradual change would be to say, okay, well, let's have a look at what I'm eating. And so here's a interesting, I'll be curious what you think about this. I liken eating to the real estate market. Now, I don't know what city
Okay.
you're in, and it doesn't really matter because it's all the same. All of us know the following about the real estate market in our cities, and that is 80% of the money in the real estate market is made by 20% of the agents. Relatively small
Okay.
group of real estate agents making the bulk of. You know who your top real estate agents are in your city. I know who the top agents are in my city. Well, guess what? The 80% of the taste is in the first 20% of the bites.
Hmm.
Similar harmonic. You start eating something and oh, it tastes so good. Now the question becomes, at what point might you say, I've had sufficient? I could stop now. So if you could shave off 20, 30%, that's great. So rather than saying I'm going to stop eating at 9 o'clock, you might say, okay, I'll have my snack, but I'm going to analyze my snack. I'm going to try to see, okay, at what point might I say, this is tasting good? Because you see, imagine if you had the following. I had a little bit and I'm glad I had it because I liked it and it didn't harm me. It didn't do damage to me. Now compare that to the guilt and the shame that people feel a half hour after they finished overeating. I sat down with a 300-gram bag of potato chips. I thought I was just going to have a few chips. I ended up eating the whole bag. I feel really bad about myself the next morning. I feel really guilty, shameful. So we might be able to alter some of that dynamic by helping people shaving a bit off. And then if you shave a bit off, you can move on. You can move on. And that can help people recognize how much of what they're eating do they really, really want? And how much of what they're
Mm,
eating
yeah.
is just, this behavioral habit of starting to eat. And I would say, you know, when I look at it as a psychologist, if you sit down with a bagel on your plate, and this is what's interesting, that bagel could be small, medium, or large, and eating that bagel is a unified experience. They have a beginning, they have a middle, and they have an end. And when you're done, you're satisfied. So it turns out that the behavioral pattern of finishing your meal is actually satisfying. And what's
Yeah.
really curious here is that the amount on your plate is maybe not as important as we think it should be, right? So
Yeah.
smaller,
That's very
yeah,
interesting. Yeah, so it sounds like I like some of the concepts you're saying, which are super important, which is drastic change and large change and quick change is not what we're looking for, and so that's why none of our resolutions ever really work, because they're like, oh, I'm going to lose 30 pounds in 30 days, or I'm going to do 500 sit-ups, but in 500 days, like really like sort
yeah,
of absurd, and maybe unrealistic goals. And really what you're saying is that sort of small change is change,
that's
and
right.
actually we and small change allows stronger build up, so we can
Yeah,
build on each one, and then we are more
yeah,
likely to create lasting change.
yeah.
And something you said earlier too is to also focus not on sort of that negative, like I don't like this about myself, but really to focus on sort of I want to a bigger and larger value. I want to be around for my family. I want to have a sustainable, healthy life. I don't want my hips to hurt in the long term. All of those sort of larger value based goals are more impactful. And then I thought it was interesting too, is that you're not saying don't eat this food at all, or don't cut out your food at 9 o'clock, because intermittent fasting is a big thing right now, or time restricted eating. You're not saying that, but you're saying maybe like, okay, you want a snack, but maybe the size could be a lot smaller.
Yeah.
There could be a lot more thought around what you're putting in, and people enjoy the small thing as much as the big thing, but they like the idea of completing it. So maybe putting a small piece of chocolate, if you're a chocolatier, that's my weakness is chocolate,
Hmm.
is that you put a small piece of chocolate on your plate and you get to finish it, you still enjoy it and you get that satisfaction of enjoying your food, whereas you didn't feel like, and then you don't, if you put a smaller piece on, then you don't feel like, oh my God, I ate this whole chocolate bar. And then the
Exactly.
next day you're like, I feel guilt and all those sort of weird
Yeah,
feelings.
absolutely. Because what happens is that your sort of processing of the food is kind of, you're processing the food. You can eat a lot before the satiety signals kind of come back, and you sort of start to feel that. So slowing the eating down, having smaller amounts, allows two things to happen. It allows your kind of your conscious ability to analyze what you're doing. It allows that more time to think
Yeah.
it through, and it also allows your body to kind of catch up. And so it becomes actually really, really important for people. The other thing I think about what you were saying around this sort of these big goals is that there's often associated, I'm going to lose 20 pounds, I'm going to get, run a half marathon, I'm going to there's often these, implicit expectations. And so it kind of sounds like this: I'm going to lose 20 pounds and everything in my life will be so much better, right? There's almost a sort of
Mm,
expectation that with these big changes, it's like what we see on TV. It's like what we see in the
yeah.
media. We have this like, you were a street person and now you're a CEO, and we've made these enormous changes, and we look at those people, and so it's kind of natural for us to sort of think about that. And that's part of the problem, because then you lose 20 pounds and it's like, my life
Nothing
is
else
still
changed.
hard. This isn't what
Yeah.
I hoped it to be. And then that's really disappointing, because a person can work really, really hard, but they sort of have these unrealistic goals. And so, we're really trying to encourage people: look in the mirror. That is your body. Celebrate your body, treat it well, promote it, be as attractive as you can be. So it's not just about, you don't have to be the most beautiful person in the world, which is a subjective standard that changes anyway. You can actually help people to sort of kind of, this is who I am, and how do I, I like the phrase, bring your best. And so what are the conditions under which you can bring your best, you as your fullest person? And I think that's what we're really trying to promote is body image acceptance, understanding that bodies differ. And when we make changes to things like our diets and such, we're trying to improve our health. We're trying to improve our well being. We're trying to be the best we can be. We're not trying to turn ourselves into somebody else. But unfortunately, I see so many people who are kind of like, I want to look like this person. And, so I'm doing this so I'll look more like this person. And I often encourage people to sort of, you have to have a pretty honest appraisal of yourself. This is your body, it's with you. How do you take care of it? And if you've ever seen, some of the sort of middle low income countries, they drive cars that are 30 years old and they function perfectly well. Why? Because they take care of them, because they don't have the ability, like most of us in North America, to buy a car whenever we choose to. And so if we think about how do you take care of your body, bring your best. And then we discover that beauty is really a subjective experience, and there's no barrier to the size of your body in terms of feeling not only physically healthy, but psychologically healthy as well.
Yeah, so two important things there, because we're trying to it's like we want people to be healthy, but we also want them to love themselves.
Exactly.
And sometimes people feel that that's a disconnect for some people, right? Because they don't love the way they look. And so I think that's interesting. So it's about saying to yourself, like, this is who I am, this is me in all my glory. But it's okay also to say, but I think I could benefit from losing some weight because I will be healthier and I'll be the best version of me. Does that sound right?
Exactly, exactly. And that best version of you will be different, right? Muscle tone, aerobic capacity, flexibility, your ability to sleep, your ability to play with your children. So many of these other indicators of health and well being will change as well. And one of the messages that people like me are really trying to improve, to really emphasize, it's not about the number, it's about the change. Because what we know about every single human who's lost weight, the weight loss is always plateaued. And that's a biological phenomena because the brain resists weight loss. And the second thing we know is we have no idea how much weight a person is going to lose when when they engage in any form of sort of change. Some people lose a little and some people lose a lot. And as you know from research, in the research studies with regard to weight outcomes, we usually have what's called a waterfall plot, which we show the pre-post changes of every single participant in the trial. And what's renowned about any trial is that some people don't lose any weight. And some people lose a tremendous amount of weight. And we don't know who's who. And so when you start this journey, it's not about, I have this expectation, I have to lose X. It's really about, get the most out of the intervention that you partake of, and then enjoy the benefits, because even small amounts, 2 to 3% body weight loss, can produce huge improvements in function and quality of life. And I'm, as a psychologist in this field, really trying to help people. I see people who work really hard and yet they don't feel very successful, and that bothers me, because people should feel the benefit of their work. And if they work hard,
Yeah.
and then and I have recently published a paper called "Weight is Not a Behavior," and so that we have to separate out what we do from the outcome that it has on our weight, because the biology takes over. And if we can celebrate those changes, that because of the efforts made and the effort you put into choosing your food, managing your activity, dealing with the stresses of your life, that effort is tremendously worthwhile, and you should be rewarded for it. You should be proud of yourself for the effort you make. And the outcomes, well, that's why we're all in this business. We're all here as healthcare professionals trying to help people with the outcomes of the efforts that they put into their care.
Yeah, I really like that, because I agree with you that there's not as much celebration of the change, and so many of my patients are, changing small things. I'm like, well, I've taken this piece out, but they're not seeing the number change. And so then they fixate on the number and the weight. And they ask me often for, well, what's the number you want to see? I can reach that. And I don't tell people a number. I'll say, well, I think that number is an artificial target. I think our goal is just to change a little bit and change a little bit more every day. That's sort of our goal, to build up over time. So, a lot of I do feel though that there's so much, disconnect, or sadness that comes with sort of associating everything with a number, or looking at the scale and not seeing it come down as much. And I like the idea that you said we need to celebrate, even 2 to 3% change is change and it makes impact. And any change you make in your body and your behavior should be celebrated. Really, really nice comments, I
Absolutely.
thought.
And those behavioral changes, they are reliable. They
Yeah.
require hard work. Navigate a grocery store, choose food at a restaurant. Every single time you're in that situation, you have to use your skills, and so you see this effort and outcome. So you can be really proud of the efforts that you make to navigate a meal choice in a restaurant away from less healthy towards more healthy foods, navigating a grocery store and staying away from your tempting food items. These are successes that will be
Yeah.
reliable. You can count on those. And so if we could help people develop a sense of control over their life, and so they're able to say, you know what, I'm working really hard, and here's my outcomes, and they are what they are. And you'll see that one of the things I like about being a psychologist is that it's the study of individual differences. So we're really very much aware that everybody has a unique pathway, and so it's about understanding that. And if I could help people to sort of find a way of looking for your effort and the outcome, what can you control? Because effort should equal outcome. If it doesn't, I work really hard and I'm getting nothing back. That's not a good psychological state, and many people will give up as a result of that. And then that's actually called learned helplessness. And in the field of weight and obesity and eating, it's so important for us to not say you need to be following this approach. We have to shift it and say what works for you. And if we can help you
Mm.
create your own personalized, tailored approach to eating. And so it could be something like time restricted eating or intermittent fasting. It doesn't, all of these methods can be helpful if they fit the person. And so please don't, anyone listening, please don't think that if someone else has done something and they've been successful, that somehow you have to do that. And if you don't, you won't be successful, because sometimes you do and you're not successful because it doesn't fit you. And if we can help people recognize that, we use a concept in psychology called the wise mind, which is many of us, if we stop and we listen to that inner voice, we can kind of identify this feels right or it doesn't feel right. And if you start to trust that, and you might note about that from the perspective of intuitive eating or mindful eating, which is really around
Hmm.
kind of reflecting on your internal values and giving yourself the opportunity to make choices that you're actually satisfied with. So, for instance, in your case, if you were able to say, "Look, I love chocolate, and I had 2 squares of this really nice chocolate, and it tasted amazing, and I didn't do any real damage to myself. So good for
Yeah.
me. It fit, and so that would mean in your case it would work. Now, maybe me, I couldn't stick to 2 squares of chocolate. Maybe the power of the chocolate over me in terms of that neurobiology of eating behavior. And in my particular case, I would say this is ice cream or licorice. In my own personal life, I stay away from those kinds of foods because they create a lot of wanting in my brain. And so if I was in your situation and I tried 2 squares of chocolate, perhaps I would have to say, you know what, I'm better off not with it. I'm better off to not have that chocolate. Maybe I'll have a sweet of something else, because that I can manage successfully.
Regulate better. Yeah.
Exactly. And this concept of
Wait.
helping people find their own pathway, I think, is actually really important, especially in this area where people are often thinking, what do you do? What do you do? I need to do what this person does. And we try to encourage people to make it their own.
Well, it's funny because, social media is like 5 things I do to stay and look like this. And, everybody's trying to follow it. And it's amazing the views that those kind of posts are getting is these are the 5 things I did to change. And everybody wants to follow it. So I think that so many of your points are super important. You said something that was, important. And you said a lot of things that are important. But one of the things you said earlier was that, part of the reason we eat so much is because of food access. And then part of the reason we eat is food access. And I want to kind of talk a little bit about that because so one of the behavioral things you've said is that we can, we got to kind of mindfully eat. We have to think about what we put in our bodies. But if it's there, we're going to eat
Yep.
it, right? And so, can you talk a little bit about food access? Because
Yes.
I also want to bring up, one of the areas I work on and am interested in is, social drivers of health, right? And a lot of those social drivers are, food
Yeah.
access related.
Yeah.
And if you only we have a place here called 7-Eleven, right, which, has loads of processed foods. And some people, that's their only place where they
Hmm.
can get food.
Yeah.
So let's talk a little bit about food access a little bit, because you brought that up as well. People are going to eat more if it's available.
Yep. So I'll context this by talking about the human brain and how decisions are made. And this has been very well understood. As a matter of fact, a psychologist by the name of Daniel Kahneman won a Nobel Prize for his work in cognitive biases and cognitive processing. So we have a conscious brain and we have an unconscious brain. And that unconscious brain is the main driver of behavior. And it has three characteristics: the pursuit of pleasure, convenience, and immediate gratification. So the caveman brain, the unconscious brain, your natural tendencies, your just automatic reactions are going to be, if it tastes good, you want more of it. And we can see that the following two substances light up the pleasure centers of the brain equally. And those two substances are sugar and cocaine. As a matter
Mm,
of fact, there are some studies that have shown that cocaine in animals give you is inferior. Sugar is up to 8 times more stimulating in the pleasure centers than cocaine, just to give you an idea.
wow.
And so then you take high fructose corn syrup and put it in almost everything, and you've got sugar. The second characteristic is to save energy, because that's how we survived, right? Many of the animals we existed on when we were hunter gatherers run faster than us. How did we ever survive? Well, we couldn't run faster than buffalo, but we could run longer. We could chase them down over 2 or 3 days. And so we had to keep all of our energy. Cavemen didn't create gyms and exercise machines because they didn't need it. And so we save energy and we make a choice with the most immediate consequence. And in the current worlds we live in, this becomes tremendously difficult, because this explains, right, the conscious brain that's in your frontal lobes, by the way, is incredibly easy to exhaust. And so tell me it's not true. In the morning, you're feeling like, okay, I can keep track of my eating, I can make choices that are relatively healthy. Lunchtime, I'm pretty good. Dinner time, okay. End of day, I'm done. I just want something that tastes good, right? That's because your frontal lobes are exhausted and this other system is taking over. So in a way, and I'm going to make a comment here that is perhaps a bit strong, but I kind of worry that our governments and our policymakers have abandoned us to the food industry that are promoting this sort of stuff. I personally believe that we as a society would have some responsibility to talk a bit about how we manufacture food, how we sell food, and whether in fact we're contributing to chronic diseases by allowing production of food such that the human is walking down aisles with packaged food that have low nutrition value but high energy, which means that you're still going to be hungry. And so, of course, you're going to overeat. That all those calories taken in by these kind of empty foods, the calories
But you're
just get
feeling
stored.
stimulated too, like you get all that stimulation.
Absolutely, you get all that. Kind of like ADHD in a bag, kind of thing. So yeah, I'm really hopeful that as we start to recognize that obesity is sort of maybe the sort of the early precursors of metabolic disorders, of other chronic diseases, cardiometabolic, renal diseases, that you see this association, that we can start to say, hang on a second, how did we get to be so big? And then you have to look at the environment in which we live, and you have to talk about access to food. And equity in this is actually super important, because those people who have food deserts, or have little access to food. For us in Canada, we see this in the north, where we'll have our indigenous communities that have really poor access to healthy foods because of the shipping costs. So it's $2 to buy a brown banana, or for $1.89 you can get a big bag of potato chips. These are some of the choices that people in the north. And when you talk about some of the citizens in your country who would be 7-Eleven is where they get their food. That's I think a really important issue to understand, that the social determinant issues are there. And I would suggest that if we wanted to really talk about health, we need to think a bit about that food environment, because again, it's a David versus Goliath. How many people can withstand the exposure to those environments? And the evidence says very few can kind of control their eating in that way. The strongest predictor of what we eat is availability. The strongest predictor of how much we eat is availability. And we then see how we're exposed to really unhealthy foods way too easy.
Yeah, I mean, there's so many. It's like it's so difficult, right? And so, yeah, I'm thinking about all the things you're saying and how small change is important, and in the mornings though we can be more focused, but then we get frontal lobe fatigue, and then by the end of the day we're like, screw it all, we're going to eat what we want to eat. And then if the food that's around you, it's like even if you have good intention and you're like, yes, I want to do this, I want to do this right, I really want to eat, you can't even get it because you don't have access to it. Or I am extremely meticulous about my eating,
Mm-hmm.
and but when I'm hungry, just like everybody, when I'm hungry, I have all of a sudden the bags of chips are
Yep.
everybody around me, and I am a healthy,
Yep.
focused person. Yeah, but they're all there.
That's
It's
right.
just sitting around there. And I have, it takes everything in me to walk away from that.
Yep.
And if all you get is Walmart,
Yep.
or Walmart, to be fair, has really improved their produce section, which I'm really proud of them for. But, if all you have is a convenience store to get your food, you're going to go with the cheapest and the one that which hits your pleasure center, right?
Yeah.
Which is so
Yeah.
challenging.
Yeah.
You know, one of the things that we are having an interesting issue with now is Ozempic.
Mm-hmm.
And I'm sure you know the
Mm-hmm.
Ozempic craze, and all of these actors and actresses are buying Ozempic and Wegovy and Manjaro. There are many of them now. Um, and then I have many patients who can't access it,
Yeah.
which also is very sad. But then there are the people that are on it, that then they come off, as we know from the data, as soon as they come off, their weight comes back.
Yep.
Um, and fundamentally, nobody's changing their lifestyle. Do you want to weigh in on that at
Yeah,
all?
I think this is such an important conversation that you're making, and I think though what I would say is that many of us believe. So I'll just full disclosure. I was on the executive of the Canadian Clinical Practice Guidelines for Obesity Management. I was the lead author on the behavioral and psychological chapter. So I am quite. This is an issue quite near and dear to my heart, and I think what's really important is that 20 years from now, we will look at obesity in the same way we looked at type 2 diabetes 20 years ago. So 20 years ago, we would have said to people living with type 2 diabetes, and 90% of people who have diabetes have type 2 diabetes, and 95% of people with type 2 diabetes live with obesity. But we would have looked at that and said to those people, look, you just have to get your sugars in control. Just eat better, move more, and your sugars will get in control. If you can't, we'll have to use drugs. And drugs were seen as almost like a punishment. And there's even a concept in diabetes, type 2 diabetes, called psychological insulin resistance, where people have developed
Hmm.
negative attitudes towards insulin. They've been given the idea that, oh, that means their disease is more serious, or that means that they've failed. And so they have these negative attitudes, as opposed to, this is a therapy that helps you. If you have diabetes, it's a glucose regulatory disease, and insulin is the perfect way to regulate your glucose. And so I think we're discovering that obesity is a fundamentally a brain related disorder where the appetite system is either genetically predisposed. And so for those of you listening, I'll do a very quick personality test. You can put yourself in one of two categories. You can't be on the fence. And those two categories are, you either eat to live or you live to eat. Eating is either fuel or it is a passion. And people put themselves in those two directions. And so most of people, they actually live to eat, where there's this fundamental drive. And so the biological system, then when you gain weight, your brain reorient. So you get this sort of protection of the highest weight. So in clinical medicine, we always encourage physicians and others to ask the question, what's been your highest adult weight? And we ask that question so we have some idea of what your brain is wanting you to get back at, like an elastic band. It wants to pull you back there. And so the era of pharmacotherapies, when you look at obesity as a chronic disease, separate from your celebrities that are looking at obesity as a social construct, and that we have to get away from, right? Your weight is not your worth. We need to help people understand that. If you're lighter, it doesn't mean you're a better person in any way, shape, or form. So if we move the social construct of obesity away and we talk about it from a medical concept, we know that fat cells, depending on where they are in your body, they are active endocrine organs. They can actively contribute to the development of disease. And that's where we see diabetes, cardiovascular disease, et cetera, et cetera, et cetera. And it's been linked to so many different diseases. And now we have medical therapies. And these medical therapies operate in the appetite system. And when you're talking about Ozempic and these other hormone-based therapies, they happen by the communication between the gut and the brain. So they kind of down-regulate the drive to eat. And they seem to be effective. So in the randomized controlled trials, and in then the EMA and the European Medical Association in Europe, who approves drugs, the FDA in the United States, Health Canada, have looked at the evidence and said these are safe drugs. These drugs are actually also helpful for cardiac protection. And now we have a medical therapy. And so, long answer to your question, Monica, is now that we have the medical therapy, now the nutritionists, the dietitians can really work to their full scope of practice, because we're now going to discover exactly as you say, people can be on these drugs, but now what about their nutrition? And many of us have struggled with healthy eating, regardless of our weight. So how I view this is that the medical therapies are kind of like type 2 diabetes. You kind of bring around medical therapies. And all of a sudden, with lifestyle interventions and medical therapies, diabetes outcomes have improved. And I think it's exactly the same. So we're trying to reframe it a little bit. And I think that celebrity use of these drugs has been a little bit frustrating for those of us in the medical community, because it's kind of almost promotes this idea of thin is better, and just using these drugs to get it off. Because like diabetes, right? If you look at someone living with diabetes and you say, when a person with diabetes stops their medication, what happens to the disease? It gets worse. When somebody with hypertension stops their medication, what happens? It gets worse. Somebody with chronic migraines who stops their migraine treatment, what happens? Their migraines get worse. Every medical disease that requires a therapy, when you stop the therapy, if the disease is still there, it comes back. So it's exactly the same thing with obesity. So it's not a matter of the drug or no drug. I think what it's a matter of is you're alluding to, we have to make these drugs available to the people that need them. And we have to promote this idea that this is not a Band-Aid. This is not a quick fix, that this is, you have a legitimate condition and you are a victim of society. I hope I've tried to emphasize that it's not the fault of the person. We have to take this blaming attitude towards individuals who live in larger bodies or who have poor nutritional habits. We have to stop blaming those people, because how did they get there? By being human. That's how they got there. They did nothing wrong except be a normal person in a world that's not okay, in a world that's overexposed to these food substances, et cetera, et cetera. So I think it's a really important thing for us to reflect on, and legitimizing nutrition. And this would be, you're a cardiologist, but I could ask you about, so is it only drugs? And absolutely not. Your own work is very much around general health and nutrition and the power that has. And I really do believe that in this current era, we now have a treatment that can help. And now that allows, I sometimes say that people like me as a psychologist, now I can work to a full scope of practice, rather than trying to help people change their behavior so that they have a calorie deficit. If the pharmacotherapy can help them create a calorie deficit by down regulating the drive to eat, I can help them with body image. I can help them with self-esteem. I can help them find other coping strategies than food. And my dietitian colleagues can help them understand proteins and carbs and fats, and how they can now that they have a lower drive to eat, how can they sort of learn, this sounds kind of funny, but how can
Yeah.
they kind of learn how to eat?
No, but I think that's such important points, because I think that we need it's a multifaceted approach for sure to have somebody lose weight, but it's not just about, to your point, losing weight. It's to living healthy and to loving yourself at the same time, and sort of loving your body, being healthy, choosing to be healthy, being okay with the medications because they are helping us in a complex society, but also needing, like, you need behavioral psychology, you need a physician, and you need a dietitian, because you really need all those pieces, because the medicine on its own is not enough.
Right.
You have to change your lifestyle, but understanding how to do that. But it's okay to use the medicine because it helps us curb our appetites. And then we do need that psychological component too, because we have to remember how why we use food, and why we've been using the food the way we've been using it, and how we can still focus and shift our value towards healthy living rather than thin living.
Absolutely. Absolutely. And I would say to you that that physician who's organizing the medical therapy, the nutrition, the dietitian who's helping with healthy eating, the psychologist, we actually make a really good team.
Yeah.
We actually work
Yeah.
really, really well together. And what I mean by that is that, I feel like the doctor brings things that I cannot do, and I can bring things that they can't do. And the dietitians are
Yeah.
necessary. And so it's actually if we start to think about more of a comprehensive care program in which we put the person at the center, and then we organize this care with has the medical, the psychological, and the nutritional, then I think we will benefit from all that we've known about behavior change, all that we know about the relationship that people have with food, and the disease component of it, such that people may still live in larger bodies, but if their health is improved, they are successfully treated. And so that's why we're really happy to see that, like, BMI is being pushed to the side, and we're now sort of looking at the way that we like to say it is that obesity management is not about weight loss, it's about health gains. And that's
Yeah.
when you start to see, even with small amounts of changes in the weight, the health gains are really what a person can actually appreciate. And again, bodies come in all shapes and sizes. We often think about people either who look like celery sticks, or they look like hourglasses, or they look like apples or pears. And people's general body morphology is genetically predetermined. And so some
Yeah.
of those people that you were describing earlier that we look up to as influencers, they've never had the problem that the rest of us have had. They've always been privileged. And many of these people, if you look at them, they're, look at me, look at me, look at me, but they've been gifted genetically. And
Yeah.
so those of us that have not been gifted genetically, well, we're the normal people. And I think that's what I really like to promote, is that I think some of the social media images are unrealistic, and at the end of the day make people feel bad about themselves. And I was at an eating disorder conference in Denmark a couple of weeks ago, and one of the group was talking about working with young women with eating disorders and diabetes, and how beneficial it was to they actually educated these young women to unfollow people based on how the post made them feel about themselves. So
Mm.
they asked the individuals, when you read this post, how do you feel about yourself? And kind of guided them to sort of unfollow people that made them feel bad, and only continue to follow people that made them feel positive. I thought that was brilliant. And I think if we
Yeah.
could
Beautiful.
somehow encourage people to do a little bit of a filter, right? Does this make me feel better about myself? Or does this make me feel worse? And go towards the light. Go towards the area that makes you feel that you can live your life to your fullest. And I think that's really I'm very optimistic with medical therapies. The kind of conversation that we're having, I'm really hoping we can really start to empower people. I go to my colleagues. I recently 2 weeks ago was at the Canadian Psychological Association presenting on obesity. And the message that I was carrying was like, come on, guys, as psychologists, we have to get in this game. We have to really be there to support people, because this is a tremendous opportunity, I think, to have a huge impact on helping people figure out how to best establish a relationship with food that is healthy for them.
Michael, it's such a pleasure to talk to you. I don't want to overtake your time, but it was so fabulous. So thank you for that. I would love to have you come back on. People are going to love listening to you. Really interesting. Made me think a lot about parenting. It made me think about sort of how the levers we use to reward
Yes.
and how we reward ourselves, even as adults. Made me think a lot about food access is certainly something I've always been focused on, but really sort of thinking about how to remove the food accesses that you can't get, but then also understanding that life is imperfect and sometimes you only have these options, that it's okay to take medication, but it's that multifaceted approach or that multidisciplinary approach where we would think about the psychology of eating, we think about the nutrition of eating, and we talk about the health of eating. I think that those are all such important points. And then also the great point you made about really focusing not on the number or the weight or the reduction as much as the healthier gain. I like that comment about health gain, which is such a nice thing to leave this with. Do you have any parting words for the audience, and where can they find you? Do you take consultations? Tell us a little bit about that.
Yeah, so I have a website called behaviorchangeinstitute.ca, just one word. And I don't do a clinical service anymore. I'm quite sort of late stage career. And my career now is really focused in on teaching these messages. And what I would say is the following: the strongest predictor of success is not giving up. And the guide, what is your North Star? So if you were to take those 2 points, it's a coin. On one side, the strongest predictor of success is not giving up. So you have to keep going. But how do you keep going in a world that can seem so dark and overwhelming? Well, what are your values? What takes you closer to the person that you really want to be? And how do, when you think about the people who love you, what do they say about you? And then go towards that direction. And if you can put those two things together, then I think there's lots of information out there. Do not be led around by the nose with all this information, right? The more people say, this is the one way to go, don't believe it. These are the 5 things I do. Great. That's you, not me. And if we could help people to, I think, really kind of find a way, because what I observe is that people, they'll figure it out for themselves if they can not give up. And it's that values-based that will allow people. And we see this in Canada, where we've tried to be, diabetes is a huge problem. And one of the things we've learned about from diabetes is learning from our multicultural citizens. So learning from people of South Asian descent, from African descent. What do you like to eat? How do you like to eat? And as a health professional in this field, it's been really valuable, because when you start to listen to people, they will inform you. And so I think what I would say to the person who's maybe listening to this is, don't underestimate your personal wisdom, because you're not there to change other people, but that wisdom can help you change yourself.
It's beautiful. Michael Vallis, Dr. Michael Vallis. All this information will be in our show notes. It's been a pleasure to have you here today, Michael, and look forward to having you here again in the future.
Thank you very much, Monica. It was a pleasure.